Yesterday, my day started on a very sad note when I got the news that a very close family friend had passed away due to sudden stroke followed by a heart attack. Now, what is stroke? What causes it? What are the signs and symptoms? What are the three indicators that can help you identify a stroke victim? And now, yes, there is a fourth indicator too for the common person to understand and how you can help them out by timely intervention. This is all that we are going to discuss today. I'm Dr. Marium Ateeq. According to the neurologists, if you take the person who has suffered with a stroke to the doctor within 3 hours of its occurrence, then they might be able to totally reverse its effects. Now, lack of awareness can spell disaster. Every year, around 15 million people are suffering with stroke, and 5 million of them die due to its complications, due to it being followed by heart attacks or seizures, and 5 million are disabled for life. 5 million of them do recover to a partial extent and some completely. So that makes it up to one death every 3 minutes 14 seconds according to the survey in 2021 and 2022. So what exactly is stroke? Stroke occurs when there is a sudden blockage or occlusion to the blood flow in a part of the brain. That may be either due to a blood clot that has wandered into the blood vessels of the brain, or that might be due to a dislodged atherosclerotic plaque, that is a fat deposit which has reached there, or it might be due to the rupture of the blood vessels in any part of the brain. All of these result in a lack of blood supply to the brain, to that area. Lack of oxygen over there starts killing the brain cells within minutes, resulting in either a temporary damage which can be reversed or an irreversible damage, and God forbid, death for many of the people. So how do you recognize these symptoms? The very thing is to act fast in this, and the very word BEFAST can help you indicate that somebody has suffered a stroke. B for balance and coordination. These people will lose balance and coordination. E is for the eye, blurring, loss of vision, or double vision in the eye, which they may complain of suddenly. Then F is for drooping of the face. Half of the body is affected, and the half which is healthy will be able to maintain its normal movements, whereas the half of the body that is affected, there the face is going to droop. Then A is the arms. The affected half will not be able to move their arms properly. They will not be able to raise up their arms. Then speech is going to be slurred, and there is going to be confusion, there is going to be disorientation, there may be dizziness, vertigo, and they may be feeling sick, they may get nauseous. And T is the time to call for emergency and get the person to the hospital. So when these signs are being displayed, what you can do to check out that are they related to stroke? Again, remember the very simple 3-word procedure. STA, and now a fourth indicator is the tongue. Now S is for smile. When you ask the person to smile, they cannot do so again due to drooping of the face. Then T is for talking. Ask them to repeat a single sentence or to say something, or when you ask them the questions, they will not be able to answer properly. And R is for raising up the arms. Normally when we are asked to raise up the arms, we raise them up equally, but in that condition the affected half of the body will not be able to do this movement, and that arm will remain on the side of the body. Now the fourth one, the tongue, which is the new one for the people to recognize, is just simply ask the person to stick out their tongue. When we are asked to do so, it comes out straight, but in case a person has suffered from stroke, the tongue is going to be crooked, it is going to be deviated towards one side, either towards the right or towards the left. and the side of deviation will indicate on which side the person has suffered the stroke. If it's the right side, the tongue will move towards the right. If it is the left side, the tongue will move towards the left. So if you do this simple test, you will know that this is the time to call for the emergency. Now, who are the people who are more predisposed to suffer stroke? They are usually the ones with high blood pressure, with diabetes, with high blood cholesterol, or with heart diseases such as the coronary artery disease, the carotid artery disease, the heart valve diseases, or atrial fibrillation, etc. And the factors which are not linked directly but they do cause heart strokes are stress and anger, because they raise the blood pressure and then all these phenomena can occur. So please spread awareness, understand the signs and spread the knowledge around so that you can help out your near and dear ones at such a time and help to save lives. Assalamu alaikum.